Good day, everyone. I am Ruel Asena, and together with me are my co-reporter, Mr. Armendariz and Mr. Janril Sambalu. Now, what we're going to do is to discuss with you a pre-final topic in this course, which is entitled Learners with Chronic Illnesses. Okay, before we proceed, may I call Mr. Kanyal to lead the prayer.
Yes, sir. Let us bow down our heads and feel the presence of God. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Lord, we offer to you our class today. We pray that through your divine guidance, we will be able to listen attentively to the inputs of our reporters. We will be able to participate actively in the discussions and activities so we could learn more while having fun, and we would be able to apply correctly what we have learned from school. As we join and leave this virtual meeting, we pray that you keep us safe from harm and illnesses. All this we ask in your powerful name. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Okay, thank you, Mr. Kanyal, for leading the prayer. Okay, before we dive into our discussion, let us read first our objective. Okay, objectives. At the end of the lesson, the learners should be able to 1. Define asthma, diabetes, epilepsy, and allergy. 2. Know the symptoms of the following chronic illnesses. And 3. Recognize the proper ways to avoid these illnesses. Okay. Now, we'll be having first an activity, and it is called picture analysis. Okay, what you're going to do is to name the picture that I will present and give 1 to 2 sentences of your observation on the picture. Okay, am I clear?
Yes, sir.
Okay, who wants to answer the first picture?
Kanyal, sir, may I?
Okay, Mr. Kanyal, go on.
I think the first picture shows allergy.
Okay, let us reveal the answer. Okay, you're correct. It's allergy. Okay, what are your observations on the photo?
Based on what I can see, I think the woman is currently suffering from an allergy. It may be because of what she ate or the environment that she is right now. She
Okay,
is in right now, sorry, sir.
okay, very good, Mr. Kanyal. Okay, how about for picture number 2? Who would like to answer?
Can I, sir?
Okay, Miss Gruyal, go on.
I think the picture shows asthma.
Okay, let's see. Okay, you're right. It's asthma. Okay, what are your observation on the photo?
So from the picture, I can see that the boy is having a hard time breathing, and someone is helping him to breathe from the, what do you call that thing? It's it gives oxygen something,
Okay, it is
or
an inhaler.
inhaler. Oh
Okay.
yes.
Okay, very good, Miss Gruyal. How about for picture number 3? Who would like to try?
Kanyal, sir,
Okay, Mr. Kanyal, go on.
I think the third picture shows diabetes, sir.
Okay, let's see if it is right. Okay, you're correct. Okay, what can you observe about this picture?
Um, I just want to define diabetes first. So based on what I have searched, sir, it's like I didn't know much about the diabetes, but diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. And based on my observation, the picture shows the signs of having a diabetes, sir. That's
Okay,
all.
you're very keen with your observation. Thank you, Mr. Kanyal. Okay, for the last picture, who would like to try?
Can I, sir?
Okay, Miss Groyal, go on.
From the picture, sir, it shows that the girl is having or has an epilepsy.
Okay, let's see. Okay, you're correct again. Okay, what can you observe about the picture?
So, based on my um, knowledge, the girl is having seizures, if
Yes,
I'm
yes, you're correct.
pronouncing it correctly, and a seizure is a sudden uncontrolled electrical disturbance in the brain. That's why she is having that thing. She is having seizure.
Okay,
That's
well done,
also
Miss. Well done, Miss Grayal. You're actually all of your answers are correct. Okay, moving on. Let's have an analysis of what we have in the previous activity. Okay, who would like to answer question number 1?
can I, sir, again.
Okay, Miss Grayal again. Okay, proceed.
So, the question number one is, what do you think are those of illnesses? Expound your answer. So I think those, all of those are what we call chronic illnesses, and chronic illnesses is one that lasts for long period of time, and typically cannot be cured. That's what I know, sir.
Okay, very good, Miss Gruya. Okay, how about for number 2? Who would like to try to answer it?
And yes, sir.
Okay, Mr. Kanyal.
So for question number 2, do you believe that those illnesses can affect learners in studying? Why? For me, sir, yes. It's like if you are a student, you have your priority, which is to value your academics. But then again, if you're suffering from chronic illnesses, the time that you will give to your academics will be limited. And so that's why it can affect your studying or studies, in other words, sir. That's all.
Yes, Mr. Kanyal, you have the right point. Chronic illnesses can affect students' life, especially when they are studying. Okay, for the last question, who would like to try? Who would like to cite other chronic illnesses aside from the pictures that I have given in the previous activity? Who can cite?
May I, sir?
Okay, Mr. Kanyal.
So other chronic illnesses would be heart disease, cancer, kidney disease, and so on, sir. I think there's so many things to say, but I just want to say less for your time. That's all, sir.
Okay. Actually, you're correct, Mr. Kanyal. So now, let
Sir,
us know
excuse me,
more.
can I add to
Okay,
the
Miss Gurayal.
So I think other chronic illnesses is stroke and arthritis.
Yes. Now let us know what is chronic illnesses. Actually, all of your answers are correct. So now let us move on. Let us know what are chronic illnesses. Okay. So chronic illnesses are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. There may be additional stresses since chronic illness might change the way you live, see yourself, and relate to others. Okay? In a nutshell, chronic illness is the personal experience of living with the affliction that often accompanies the chronic disease. It is often not recognized in health systems because it does not fit into a biomedical or administrative classification. Excuse me. Okay. Nevertheless, children who have chronic illness or condition often feel different, socially isolated and restricted in their activities. Okay. They may have school problems and difficulties are not dealt with. Okay. They can lead and those can lead to anxiety, sadness, withdrawal, rebelliousness, or a decreased interest in school. Okay, moving on. We'll now know what are the effects of chronic illness on schooling. Okay, students with chronic illnesses may miss a lot of schools. This might be because they need to go to the hospital, recovering at home, or attend regular medical appointments. And this can lead to, first, difficulty completing work on time or taking part in exams. Next is decreased academic performance, okay? And next is difficulty keeping up relationships with school friends. Other is difficulty getting around the school environment. Next is difficulty participating in some school activities, for example, physical education or excursions. And lastly, feeling less confident and less motivated also possibly affects self-esteem and body image. So with the chronic illnesses, learners chronic illness have what we call this negative impacts on students, especially in schooling. Okay. So now we will know the support or how we can support students with chronic illnesses. Okay. The family and the school need to work together to establish and maintain good communication and cooperation. Everyone needs to understand what is needed and expected to support their child. The family and the school also need to be clear about what can and cannot be done so that everyone's expectations are achievable and realistic. Okay, here are the important things to remember. First is share information. Okay, sharing information about those specific chronic illnesses on the students can promote, inform, understand, and be aware on its effect on a person. Next is develop a care plan. Okay, so developing a care plan helps parents, teachers, as well as students to specify their healthcare and support needs and outlines on how the provider or the students will meet their requirements. Next is to keep up good communication. Okay, patient education, shared decision making, and motivational interviewing are key patient communication tactics for chronic disease. For chronic disease prevention, as well as encouraging children to develop their own coping skills. Next, important thing is make changes where necessary. Okay, so we must not stick to certain things where they will only go to negative effects on students. Therefore, we must find other ways that are more necessary for coping with the students' motivation. And lastly, last important thing is to seek extra support. Okay, if you feel that your care would not be enough, try to find extra support from those who are expert in dealing with chronic illnesses patients. Okay, moving on. Now we're going to know the common chronic illnesses among learners. First, we have what we call the asthma. Okay, according to World Health Organization, asthma is a long-term condition affecting children and adults. The air passages in the lungs become narrow due to inflammation and tightening of the muscles around the small airways. This causes asthma symptoms such as cough, wheezing, shortness of breath, and chest tightness. These symptoms are intermittent and are often worse at night or during exercise. Okay, so asthma is often underdiagnosed and undertreated, particularly in low and middle income countries like the Philippines. People with undertreated asthma can suffer sleep disturbance, tiredness during the day, and poor concentration. Asthma sufferers and their families may miss school and work with a financial impact on the family and on wider community. If symptoms are severe, people with asthma may need to receive emergency health care and they may be admitted to a hospital for treatment and monitoring. In the most severe cases, asthma can lead to death. Okay, here are the symptoms of asthma. Asthma signs and symptoms include shortness of breath, chest tightness or pain, wheezing when exhaling, which is common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing or wheezing, and coughing or wheezing attacks that are worsened by a respiratory virus such as cold or flu. Okay, signs that your asthma is probably worsening include asthma signs and symptoms that are more frequent and bothersome, increasing difficulty breathing as measured with a device used to check how well your lungs are working, or what we call peak flow meter, and the need to use a quick relief inhaler more often. Okay, for some people, asthma signs and symptoms flare up in certain situations. And here are the three factors. First, we have the exercise-induced asthma, which may be worsened when the air is cold and dry. Second is occupational asthma, triggered by workplace irritants such as chemical fumes, gases, or dust. And the last factor is allergy-induced asthma, triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets, or what we call pet dander. Okay, seek emergency treatment. Okay, when severe asthma attacks can be life-threatening, work with your doctor to determine what to do when your signs and symptoms worsen and when you need emergency. Okay, here are the signs of an asthma emergency. First is the rapid worsening of shortness of breath or wheezing. Second is there is no improvement even after using a quick relief inhaler. And the last is shortness of breath when you are doing minimal physical activity. Okay, when you experience this worsening of asthma, you must go to the nearest hospital or must treat it immediately. Okay, moving on. Here are the proper ways to prevent asthma attacks. Okay, while there's no way to prevent asthma, you and your doctor can design a step-by-step plan for living with your condition and preventing asthma attacks. First in the list is to follow your asthma action plan. With your doctor and mental health care team, write a detailed plan for taking medications and managing an asthma attack. Then be sure to follow your plan. Asthma is an ongoing condition that needs regular monitoring and treatment. Taking control of your treatment can make you feel more in control of your life. Next way is to get vaccinated for influenza and pneumonia. Staying current with vaccinations can prevent flu and pneumonia from triggering asthma flare-ups. Next way is to identify and avoid asthma triggers. A number of outdoor allergens and irritants ranging from pollen and mold to cold air and pollution can trigger asthma attacks. So, you must find out what causes or worsens your asthma and take steps to avoid those triggers. The other way is to monitor your breathing. You may learn to recognize warning signs of an impending attack, such as slight coughing, wheezing, or shortness of breath. But because your lung function may decrease before you notice any signs or symptoms, you must regularly measure and record your peak airflow with a home peak airflow meter. Okay, another way is to identify and treat attacks early. Okay, if you act quickly, you're less likely to have a severe attack. You also won't need as much medication to control your symptoms when your peak flow measurements decrease and alert you to to oncoming attack. Always take your medication as instructed. Okay, next is to take your medication as prescribed. Okay, don't change your medication without first talking to your doctor, even if your asthma seems to be improving. It's a good idea to bring your medications with you to each other's visit, or I mean to the doctor's visit. Your doctor can make sure you're using your medication correctly and taking the right dose. And last way to prevent asthma attack is to pay attention to increasing quick relief inhaler use. If you find yourself relying on your quick relief inhaler, such as albuterol, your asthma isn't under control. So you must see your doctor about adjusting your treatment. Okay, that's all about my part, which is the asthma. Here is Mr. Rovic Armendariz for the continuation.
So good day, everyone. So now I will be tackling about diabetes. Next slide, please. Okay, so what is diabetes? Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar or glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues. It is also the brain's main source of fuel. The main cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in the blood can lead to serious health problems. Next slide, please. Okay, so symptoms. Diabetes symptoms depend on how high your blood sugar is. Some people, especially if they have the pre-diabetes or type 2 diabetes, may not have symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the symptoms of type 1 diabetes and type 2 diabetes are feeling more thirsty than usual, losing weight without trying, presence of ketones in the urine. Ketones are byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Fourth one is feeling tired and weak. Next is feeling irritable or having other mood changes, and having blurry vision. And next is having slow healing sores. And last one is getting a lot of infections such as gum, skin, and vaginal infections. So when to see a doctor? First is if you think you or your child may have diabetes, you may notice any possible diabetes symptoms. Contact your healthcare provider. The earlier the condition is diagnosed, the sooner treatment can begin. The second one is if you've already been diagnosed with diabetes. After you receive your diagnosis, you'll need close medical follow-up until your blood sugar levels stabilize. So the causes. So to understand diabetes, it is important to understand how the body normally uses glucose. Next slide, please. Okay, so how insulin works. Insulin is a hormone rather that comes from a gland behind and below the stomach or the pancreas. So the first one is the pancreas releases insulin into bloodstream. Second, the insulin circulates letting sugar enter the cells. Third, insulins lower the amount of sugar in the bloodstream. And the last one is as the blood sugar level drops, so thus the secretion of insulin may from the pancreas. Next slide. So the role of glucose. Glucose is a sugar, is a source of energy from the cells that make up muscles and other tissues. The first one is glucose comes from the two major sources, which is food and the liver. Second, sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Third, the liver stores and makes glucose. And the last one, when glucose levels are low, such as when you are not eaten in a while, the liver breaks down stored glycogen into glucose. This keeps your glucose level within a typical range. So the exact cause of most type of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because that the pancreas doesn't produce enough insulin. Both type 1 and type 2 diabetes may cause by a combination of genetic or environmental factors. It is unclear what those factors may be. Next slide, please. So here are the risk factors for diabetes. So risk factors for diabetes depends on the type of diabetes. Family history may play a part in all types. Environmental factors of geography can add to the risk of type 1 diabetes. Sometimes, family members of people with type 1 diabetes are tested for the presence of diabetes immune system cells. If you have the autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these autoantibodies develops diabetes. So race or ethnicity also may raise your risk of developing types of 2 diabetes. Although it's unclear why certain people, including Black, Hispanic, American, Indian, and Asian American people are at high risk or higher risk. So the pre-diabetes, type 2 diabetes, and gestational diabetes are common in people who are overweight or obese. Next slide, please. So next is the complications. So long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. In fact, pre-diabetes can lead to type 2 diabetes. Possible complications include heart and blood vessels disease. So it means diabetes majority increases the risk of many heart problems. This can include coronary artery disease, which chest pain, heart attack, stroke, and narrowing of arteries. If you have diabetes, you more you are more likely to have heart disease or stroke. The second one is nerve damage. Too much sugar can injure the walls of the tiny blood vessels that nourish rather the nerves, especially in the legs. This can cause tingling, numbness, burning of or pain that usually begin at the lips, eye tips of the toes or fingers gradually spreads upward. And the third one is kidney damage. The kidney hold millions of the tiny blood vessels clusters that filter waste from the blood. Diabetes can damage this delicate filtering system. And the next one is eye damage. Diabetes can damage the blood vessels of the eye. This could lead to blindness. Next one is foot damage. Foot damage nerve damage in the feet or poor blood flow to the feet increases the risk of many foot complications. Next is skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Next is hearing impairment. Hearing problems are more common in people with diabetes. So next one is Alzheimer's disease. Type 2 diabetes may increase the risk of dementia such as Alzheimer's disease. And the last one is depression. Depression symptoms are common in people with type 1 and type 2 diabetes. Next slide, please. Okay, so the complications of gestational diabetes. Most women who have gestational diabetes deliver healthy babies. However, untreated or uncontrolled blood sugars level can cause problems for you and your baby. So complications in your baby can be caused by gestational diabetes, including excess growth, low blood sugar, type 2 diabetes later in life, and death. So excess growth, extra glucose can cross the placenta. Extra glucose trigger the baby's pancreas to make extra insulin. This can cause your baby to grow too large. It can lead to a difficult birth and sometimes that need for a C-section. Second one is the low blood sugar. Sometimes baby of mothers with gestational diabetes develop low blood sugar shortly after birth. This is because their own insulin production is high. And the third one is type 2 diabetes later in life. Babies of mother who has gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. And the last one is death. Untreated gestational diabetes can lead to a baby's death either before or shortly after birth. So the next one is complications in the mother also can be caused by gestational diabetes, including preeclampsia and gestational diabetes. So preeclampsia, symptoms of the conditions include high blood pressure, too much protein in the urine, and swelling in the legs and feet. Gestational diabetes, if you had gestational diabetes in one pregnancy, you're more likely to have it again with your next pregnancy. So next slide, please. So now, let's proceed to the prevention. The type 1 diabetes can be prevented, but the healthy lifestyle choices that help treat pre-diabetes, type 2 diabetes, and gestational diabetes can also help prevent them. First, eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grain. Eat a variety to keep food feeling bored. The second one is get more physical activity. Try to get about 30 minutes of moderate aerobic activity on most days of your week, or aim to get at least 150 aerobic activity a week. For example, take a brisk daily walk if you can fit in a long workout. Break it up into smaller sessions throughout the day. The last one is lose excess pounds. If you're overweight, losing even 7% of your body weight can lower the risk of diabetes. For example, if your weight pounds is 6.4 kilograms, can lower the risk of diabetes. But don't try to lose weight during pregnancy. I talk to your provider about how much weight is healthy for you to gain during pregnancy. So keep your weight in a healthy range. Work on long-term changes to your eating and exercise habits. Remember that benefits of losing weight, such as a healthier heart, more energy, and higher self-esteem. Next slide, please. Okay, so the next topic I will be tackling is all about epilepsy. Next slide. So what is epilepsy? So epilepsy is a neurological condition that causes unprovoked recurrent seizure. A seizure is a sudden rush of abnormal electrical activity in your brain. Doctors diagnose epilepsy when you have two or more seizures with no other identifiable cause. Anyone can develop epilepsy, but in the commonly trusted source onsets in young children and older adults. According to the research published in 2021, men develop epilepsy more often than women, possibly because of higher exposure to risk factors like alcohol use and head trauma. Next slide, please. So there are two main types of seizure are generalized and focal. So generalized seizure affects whole brain, while focal or partial seizure affect only one part of your brain. A mild seizure may be difficult to recognize. It may also last a few seconds, and you may remain awake while it happens. A stronger seizure can cause spasms and uncontrollable muscle twitches. They can last from a few seconds to several minutes and cause confusion or loss of consciousness. Afterward, you may have no memory of seizure happening. Next slide, please. So what are the symptoms of epilepsy? So seizure are the main symptom of epilepsy. Symptoms differ from person to person and according to the type of seizure. Next slide, please. So now let's proceed to the focal partial seizure. A focal aware seizure, previously called simple partial seizure, that not involve loss of consciousness. Symptoms include: first is alterations to sense of taste, smell, sight, hearing, or touch. And the next one is dizziness. Third is tingling and twitching of limbs. So the focal unaware seizure, previously called complex partial seizure, involve loss of awareness of consciousness. Other symptoms include: first, staring blankly. Then second is unresponsiveness. Third is performing repetitive movements. Next slide, please. So the generalized seizure. Subtitle includes absence seizure, tonic, atonic, clonic, myoclonic, and tonic-clonic. So the first one is the absence. So the absence seizure, also called petit mal seizure, they tend to cause a short loss of awareness, a blank stare, and may cause repetitive movements like lip smacking or blinking. The second one is the tonic. Tonic causes sudden stiffness in the muscles of your legs, arms, or tongue, or trunk rather. And the third one is atonic. Atonic lead to loss of muscle control. They also called drop seizure because a sudden loss of muscle strength can make you fall suddenly. And the fourth one is the clonic. Clonic seizure are characterized by repeated jerky muscle movement of the face, neck, and arm. The fifth one is myoclonic. So myoclonic causes spontaneous quick tweaking of the arms and legs. Sometimes these seizures cluster together. So the last one is the tonic-clonic. So it is used to call grand mal seizure. Symptoms includes stiffening of the body, shaking, loss of bladder or bowel control, biting of the tongue, and loss of consciousness. So the following seizure, you may not remember having one, or you might feel slightly ill for a few hours. Next slide. So what causes epilepsy? In about half of people with epilepsy, the cause cannot be determined. Per the WHO, a variety of factors can contribute the whole development of seizure, such as traumatic brain injury or other head and trauma. Next is brain scarring after a brain injury. Third is serious illness or very high fever. Fourth is stroke, which causes about half of epilepsy causes in older adults when there is no identifiable cause according to the CDC. And next is lack of oxygen to the brain tumor, dementia, including Alzheimer's disease. And next is material use of some drugs, prenatal injury, brain malformation, or lack of oxygen at birth. Next one is infectious conditions like HIV and AIDS and meningitis. And the last one is genetic or developmental disorder or neurological diseases. Next slide, please. So, what triggers an epileptic seizure? Some people identify things of situations that trigger the seizures. A few of the most common known triggers are lack of sleep, illness or fever, stress, bright lights, flashing lights or patterns, caffeine. Next is caffeine, alcohol, or alcohol withdrawal medications or illegal drugs. The next is skipping meals, overeating, or specific food ingredients. Next is very low blood sugar. Then the last one is head injury. Next slide, please. So how epilepsy treated? So it treated for epilepsy may help you have fewer seizures or stop seizure completely. Your treatment plan will be based on anti-epileptic, vagus nerve stimulator, ketogenic diet, or brain surgery. So the anti-epileptic drug can help reduce the number of seizures you have. In some people, they may eliminate seizure. To be most effective, the medication must be taken exactly as your doctor prescribed. The next one is the vagus nerve stimulator. This device is surgically placed under the skin of your chest and electrically stimulates the nerve that runs through your neck to prevent seizures. The third one is ketogenic diet. So according to the Epilepsy Foundation, more than half of the children who do not respond to medication benefit from the ketogenic diet, which is a high fat and low carbohydrate diet. The last one is the brain surgery. So the area of the brain that causes seizure activity can be removed or altered if your healthcare team determine it's the right treatment of your condition or for your condition. So next slide, please. So that's all about epilepsy, and my other members or group mates will continue the discussion. Thank you.
Thank you, Mr. Armendariz. Good evening, everyone. My name is Janiel Orozco Sambalod, and this time I'm going to tackle about allergy. But before we begin into tackling about allergy, I will first give you the overview of this kind of chronic disease. Allergies are your body's reaction to a normally harmless substance such as pollen, molds, animal dander, latex, certain foods, and insect stings. Allergy symptoms range from mild to rash or hives, itchiness, runny nose, watery or red eyes, to life-threatening. Treatments include antihistamines, decongestants, nasal steroids, asthma medicines, and immunotherapy. Okay, so what are allergies? Allergies are your body's reaction to a substance it views as a harmful invader. For example, coming into a contact with what is normally a harmless substance, such as pollen, might cause your immune system to react. Our immune system is our body's defense system. Substances that cause these reactions are called allergens. Next slide, please. All right. So what is an allergic reaction? An allergic reaction is the way your body responds to an allergen. A chain of events that occur that result in an allergen reaction. If you are prone to allergies, the first time you're exposed to a specific allergen, such as pollen, your body responds by producing allergic antibodies. The job of these allergic antibodies is to find the allergens and help remove them from your system. As a result, a chemical called histamine is released and causes symptoms of allergies. Next slide, please. And what are the types of allergies? And how are these allergies be treated? You can be allergic to a wide variety of substances, including pollen, animal dander, mold, and dust mites. So I have here the types of allergies. The first one is pollen. The second one, dust mites. The third one is molds. Next slide, please. The fourth one is animal dander. Fifth one, latex. Sixth, certain foods. And the seventh one would be, or the last one is an insect venom. But first, let us discuss what is pollen, or what kind of allergy is pollen. Seasonal allergic rhinitis, or hay, is an allergic response to pollen. This kind of allergy causes inflammation and swelling of the lining of your nose and of the protective tissue of your eyes, or the conjunctiva. Conjunctiva, I mean. And the symptoms in this kind of allergy include sneezing, congestion, or the feeling stuffy and itchy, watery eyes, nose, and mouth. The treatment options of this kind of allergy include over-the-counter and prescription oral, antihistamines, anti-leukotrienes, nasal steroids, nasal antihistamines, and nasal cromolyn. In some allergic asthma symptoms include wheezing, shortness of breath, coughing, and or chest tightness can be caused by exposure to pollen. Your symptoms can be reduced by avoiding pollen. So how to avoid this kind of allergy? Let us always stay indoors when pollen counts are high. Close your windows and use air conditioning. Let us also ask our healthcare providers about immunotherapy or allergy shots to treat pollen allergy. Those are the ways to avoid pollen. Now let us move on to dust mites. Okay, what are dust mites? Dust mites are tiny organisms that live in dust and in the fibers of household objects such as pillows, mattresses, carpet, and upholstery. Dust mites grow in warm, humid areas. So if we feel that the area is warm, let us always assume that dust mites might grow in that area. Okay, so the symptoms of dust mite allergy are similar to those of pollen allergy. To help manage dust mite allergies, we are going to try using dust mite encasements or the airtight plastic or polyurethane covers over pillows, mattresses, and bug springs. Also, let us remove carpet or vacuum frequently with a high efficiency filter vacuum cleaner. This type of cleaner can be afforded or those people who are rich can afford this type of cleaner, but in ours we only clean those areas by wiping or by washing our pillows. All right, so treatment may include medications to control your nasal or eye and chest symptoms. Immunotherapy may be recommended if your symptoms are not adequately controlled with avoidance methods and medications. Those are ways of treatment for dust mites. Another one that triggers allergy are molds. Molds are tiny fungi like penicillium with spores that float in the air like pollen. So these kind of fungi are like pollen. Mold is a common trigger for allergies. Mold can be found indoors in damp areas such as the basement, kitchen, or bathroom, as well as outdoors in grass, leaf piles, hay, mulch, or under mushrooms. Mold spores reach a peak during hot, humid weather. So molds and dust mites, they grow in the same area in warm, humid areas. These kind of molds can be treated through medications to control your nasal or eye and chest symptoms. And immunotherapy may be recommended if your symptoms are not adequately controlled with avoidance and medications. Okay, another thing that triggers the allergy is the animal dander. Allergic reactions can be caused by the proteins secreted by sweat glands in an animal's skin, which are shed in dander, and by the proteins in an animal's saliva. Avoidance measures don't work as well as simply removing the pet from your home. However, because many people are reluctant to do this, the second best measures include keeping your pet out of your bedroom, using air cleaners with HEPA filtration, and washing your pet frequently. Okay, so let's not keep our dogs always in our bedroom because they can be one of the reasons to trigger our allergies. Okay, so treatment. Next slide, please. Can you please go back? I forgot to add something. Treatment for this allergy include medications to control nasal or eye chest symptoms. This kind of treatment is similar to modes. So I'm not going to elaborate further. Next slide, please. Okay, latex or latex. Latex, some people develop latex allergy after repeated contact with latex or latex. Rubber gloves, such as those used in surgery or home cleaning, are a major source for causing this type of reaction. Skin rash, hives, eye tearing and irritation, wheezing and itching of the skin may occur if you have a latex allergy. Allergic reactions to latex can be mild, such as skin redness and itching. More severe reactions can occur if your mucosal membranes are exposed, such as during an operation or a dental gynecologic exam. Treatment of latex reactions begins by removing the offending latex product. If you have latex allergy, it is important for you to wear a medic alert bracelet and carry an emergency epinephrine kit. All procedures should be carried out in a latex-safe fashion. There is no cure for latex allergy. So the best treatment for this condition is prevention and avoidance. Remember that. Now, food allergies develop when your body develops a specific antibody to a specific food. An allergic reaction occurs within minutes of eating the food, and symptoms can be severe. In adults, the most common food allergies are shellfish, peanuts, and tree nuts. However, in children, they include milk, egg, soy, wheat, shellfish as well, peanuts, and tree nuts. If you have a food allergy, your symptoms include itching, hives, nausea, vomiting, diarrhea, breathing difficulties, and swelling around your mouth. It is extremely important to avoid the foods that cause allergy symptoms. If you or if your child have a food allergy, your doctor may prescribe injectable epinephrine or adrenaline for you to carry at all times. This is needed in case you accidentally eat foods that cause allergies. There are new therapies for peanut allergies called oral immunotherapy. And for the last one, last type of allergy include insect venoms or the stings. If you get a bee sting, A normal reaction includes pain, swelling, and redness around the sting site. A large local reaction includes swelling that extends beyond the sting site. For example, if you are stung on the ankle, you may see swelling in your leg. And the most serious reaction to an insect sting is an allergic one, which needs immediate medical attention. And symptoms of this kind of allergy include difficulty breathing, generalized widespread hives that appear as red, itchy rash that spread to areas other than the area that was stung, swelling of your face, throat, or mouth tissue. Rapid pulse, and last one, dizziness or a sharp drop in your blood pressure. If you have a reaction like this, resting can cause a serious reaction that can be life-threatening. An allergic reaction is treated with epinephrine or the adrenaline. And if you've had an allergic reaction to bee stings, see a board certified allergy or immunologist to get a skin and or blood test to confirm your allergy to bee venom. Venom immunotherapy is recommended if venom allergy is confirmed. This will help reduce the possibility that a sting will cause a serious reaction. And those were the types of allergies. It includes the first one. The first one is pollen. The second one, dust mites, molds, animal dander, latex, certain foods, and last one that I've tackled or I've elaborated was insect venom. Next slide, please. Knowing the types of allergies, now let us move on to answering what is an allergic rhinitis. Nasal allergy symptoms and hay fever are referred to as allergic rhinitis. Seasonal allergic rhinitis is nasal allergies that change with the seasons because of pollen from plants, such as trees, grasses, or weeds. Seasonal symptoms arise during the pollinating seasons for a particular plant. Because you can be allergic to more than one thing, your symptoms may get worse at different times throughout the year or may be constant. It means that your allergy will not stop, or it will continue through time. Next slide, please. Let us also answer this question. Does everyone get an allergy? No, not everyone can get an allergy. Most allergies are inherited, which means they are passed on to children by their parents. People inherit a tendency to be allergic, although not to any specific allergen. And if your child develops an allergy, it is very likely that you or your parent or your partner, has allergies. And how common are allergies? More than 50 million Americans, 1 in 6, experience all types of allergies, including indoor or outdoor allergies, or food and drug, latex, insect, skin, and eye allergies. The number of people who have allergies continue to increase across all ages, sex, and racial groups. So allergies, they don't choose type of people, but they affect everyone or everybody. Next slide, please. Okay. So what are the symptoms of allergies? Allergy symptoms are classified as mild, moderate, or severe. In the first bullet, mild reactions include local symptoms or affecting area of your body, such as rash or hives, itchiness, watery or red eyes, hay fever, and runny nose. And mild reactions do not spread to other parts of your body. So do not be afraid of this kind of reaction. But moderate reactions include symptoms that spread to other parts of your body. Symptoms in this kind of reaction may include itchiness, hives, and or swelling, and trouble breathing. And a severe allergic reaction known as anaphylaxis, anaphylaxis is a rare life-threatening emergency in which your body's response to the allergen is sudden and affects the whole body. Anaphylaxis may begin with severe itching of your eyes or face. And within minutes, more serious symptoms appear, including throat swelling, which could cause problems with swallowing and breathing, and abdominal pain, cramps, vomiting, diarrhea, hives, and swelling, or such as angioedema. You may also have mental confusion or dizziness, since anaphylaxis may cause a drop in blood pressure. Another question: what causes allergies for you? Okay, so anything that you come into contact with that your body views as harmful invader can be a cause of an allergy. Normally, harmless substances that are common cause of allergies include pollen, animal dander, mold, dust, foods, insect venom, and latex. Technically, your symptoms are the result of your chain of events that are your body's response to the harmful invader. Your body sees the invader, makes antibodies to fight the invader, and in so doing, releases histamines that cause your allergy symptoms. And how are allergies diagnosed? If you think you have allergies, don't wait to see if your doctor's symptoms go away. When your symptoms last longer than a week or two and tend to come back, make an appointment with an allergy or immunology specialist. Allergy skin testing may be used to identify the allergens that are causing your allergy symptoms. The test is performed by pricking your skin with an extract of an allergen and then checking your skin's reaction. If a skin test can be performed, blood work may be obtained. This test is not as sensitive as a skin test. The test evaluates the number of antibodies produced by your immune system. Higher levels of certain antibodies suggest possible allergy to that allergen. Okay. So how are allergies treated? Although avoiding the allergen is an important treatment approach, it usually doesn't completely end the allergic reaction. Medications such as antihistamines, for example, Allegra, Zyrtec, decongestants, Example, Sudafed, Contact, or a combination of over-the-counter and prescription medications are used to treat your allergy symptoms. Nasal sprays such as topical nasal steroids, for example, Flonase, Nasonex, Cromolyn sodium, and topical nasal antihistamines also can be used to treat allergy symptoms. Next slide, please. Another question, I think it's the last question for this lesson. Can allergies be cured? Allergies cannot be cured, but symptoms can be controlled using a combination of avoidance measures and medications, as well as allergen immunotherapy in properly selected areas. So please remember, allergies cannot be cured, but it can be avoided and prevented. All right, so that's it for allergy, and I hope that you've gained some important information from this lesson. Now may I ask here, what are those chronic illnesses that we've discussed or we've mentioned? Who can give me the type of chronic illnesses that were discussed here?
Me, sir.
Okay, please proceed, Mr. Asena.
Okay, the kind of chronic illnesses that discussed was, first is asthma, second is diabetes, third is what we call the epilepsy, and lastly is the allergy, sir. That's all.
Yes, very good, Mr. Asena. You have a good memory. And those were the kinds of chronic illnesses that is common in us. Now let's have the activity. Are you ready for this activity? If you listened attentively in our discussion, you can answer these 15 statements directly and orally. Okay, instruction, read and answer the following statements orally. It means once you've done reading the question, you will immediately answer it orally. All right, so are you ready, everyone?
Yes, sir.
Yes,
Yes,
sir.
sir.
That's good. Here, who will answer the first statement or
Can I,
question?
sir?
Mr. Armendariz.
So number 1, define broadly as conditions that last 1 year or more and required ongoing medical attention or limit activities of daily living or both. So I think the answer of this question is chronic illnesses.
We will know that later, but I think your answer is correct. Okay, for the second number, who will try to answer?
Can I,
Yes,
sir?
May I?
Please proceed, Miss Gruyal.
Number 2 is a condition in which your airways narrow and swell and may produce extra mucus. My answer, sir, is asthma.
What do you think it is?
Asthma, sir.
Okay, very good. How about the third number?
Kanya, sir.
You may, Mr. Kanyal.
And number 3, an important approach to supporting students with chronic illnesses. I believe it's the whole school approach, sir.
Very good. Okay, the fourth one. Who will try to answer?
Me, sir.
Go on, Mr. Asana.
Okay. Number 4. Triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets or pet dander. The answer would be um, allergy-induced asthma, sir.
All right, that's it. That's correct. And for the fifth number,
Can I, sir?
please proceed, Miss Gruyal.
Number 5. Number 5, sir, no?
Yes, Miss Gruyal.
So number 5, triggered by workplace irritants such as chemical fumes, gases, or dust. My answer, sir, is I think allergy, sir.
For number 5,
For number 5.
let us see if your answer is correct later. For number 6, who wants to answer?
Kanyal, sir.
Okay, Mr. Kanya.
For number 6, it is a neurological condition that causes unprovoked recurrent seizures. I believe it's epilepsy, sir.
Thank you, Mr. Kanya. How about number 7?
Nice, sir.
Okay, Mr. Menderes.
So number 7 refers
Number 7
to a group of
refers to a group of diseases that affects how the body uses blood sugar or glucose. So I think the answer is diabetes.
Very good, Mr. Menderes. How about the 8th number?
Like,
Me, sir.
Okay, Mr. Asana.
Number 8, an important source of energy for the cell that make up the muscle and tissues. It's also the brain's main source of fuel. The answer will be glucose, sir.
What's your answer, Mr. Asana?
I think it's glucose.
Yes, you're right. How about number 9?
nice, sir.
Okay, Miss Gruyal.
Number 9 is the two main types of seizures are the generalized and focal.
Very good. How about number 10?
Can I, sir?
Yes, Mr. Menderes.
Symptoms are
common in people with type
common in people with type 1 and type 2 diabetes. So I think the answer is depression.
All right. How about number 11? I think Miss Sarim is here.
Yes, sir. 11. These are your body's reaction to a substance it views as a harmful invader. The answer for this is allergy, sir.
Yes.
I mean, yes. Yes.
Very good, Miss Sarim. How about number 11?
Sir, I think we're on number 12.
Number 11, we're done.
Okay, number 12. Rather.
Kanyal, sir, I want to answer on number 12.
Yes, Mr. Kanyal.
Is the way your body responds to allergen. I think it's allergic reaction.
Very good. How about number 13?
May I, sir?
Yes, you can, Miss Sarim.
These grow in warm, humid areas. The answer for this is dust mites.
All right. How about number 14?
Can I, sir?
Please proceed, Miss Gruyal.
Number 14, nasal allergic symptoms and hay fever are referred to what? My answer, sir, is allergic rhinitis.
Okay, and for the last number, who will try to answer?
Me, sir. Okay,
Proceed,
number
Mr. Asad.
15. Symptoms may include itchiness, hives, and or swelling and trouble breathing. Um, my answer will be moderate reaction, sir.
Okay, so we will know the answers once it is revealed. Can you please show the answers? All right, so did you remember your answers? I guess no, but since I have taken all your answers, I think only the number 5 were mistakenly answered. It should be occupational asthma. It was a nice try, but you only got one mistake, and one mistake is, and having a score of 14 is a very, very nice score. Please clap all your hands to appreciate all your efforts. And that ends our discussion for today. May I just recall all the chronic illnesses so that you will remember what are those. The chronic illnesses include asthma, diabetes, epilepsy, and allergy. And thank you everyone for listening. I hope that you will bring those learnings into reality. And I hope that you learned something from this lesson.
Thank you. Thank you, sir.
Thank
You're
you,
welcome.
sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Goodbye.
Thank you, classmates.
Bye.
Bye.